CYTER, the Center for Yoga Therapy Education and Research, is located in Pondicherry, India. The center is part of the Mahatma Gandhi Medical College of Sri Balaji University. Mahatma Gandhi Medical College is distinguished as having one of the first complete yoga therapy centers in India. It also has one of the first postgraduate programs in yoga therapy within a medical university in India. This focus on yoga therapy is part of Mahatma Gandhi Medical College's overall vision, since the university was approved by the Indian government specifically to explore innovative approaches to medicine. All of the alternative approaches, including yoga therapy, are housed on the first floor of a new 7-story structure. CYTER, which has 5 different facets, is the department within the hospital responsible for all yoga therapy related work. There is a patient treatment program, yoga therapy research programs, a postgraduate program in yoga therapy, ongoing education for the medical staff, and outreach programs in yoga and yoga therapy for the local community. The Vice Chancellor of the University, Dr. K.R. Sitaraman, has had more than 20 years of experience utilizing yoga as an adjunct therapy. Dr. Sitaraman explains the importance of CYTER within the medical college.
This hospital is quite new, but Professor Madan Mohan and myself, we have been doing yoga therapies for more than 20 years now, since 93 or 94. In an earlier place where we worked in Pondicherry, there is a central institute, JIPMA, where he was head of physiology and I was head of medicine. So we had a lot of patients who were in evidence-based medicine. You give the best evidence therapy and they don't recover fully. As a physician, I've been sending to yoga therapy for adjunct help. On top of the other medications and other scientific practices that we do, there's an adjunct thing. It really improves quality of life. That's what I find.
The Center for Yoga Therapy Education and Research was conceived as a resource where patients can receive training and guidance in developing a healthy, holistic lifestyle based in yoga.
So we have set up the whole floor, which you saw, the first floor in I block, is for complementary and alternate systems. We have yoga there, we have music. We are starting homeopathy division also as a collaborative research wing, and also offering services to patients.
One of the keys to the yoga therapy at CYTER is that it is not just offering yoga techniques in an allopathic manner to treat disease.
Most people think yoga means it's only the exercises and the contortions and all that. But yoga therapy is a very important aspect of mind development, especially coping with chronic diseases.
These innovative approaches are an important part of Mahatma Gandhi Medical College's vision for the future.
We have started a formal postgraduate certificate and postgraduate diploma in yoga therapy. And through that we want to disseminate this. And if this postgraduate diploma is successful, then other universities are free to adopt. So we hope that the message will spread across, and in 10 years' time, there will be enough scientifically trained yoga people who are also qualified in modern medicine to offer integrative approach to scientific management along with a traditional help of yoga.
The director of CYTER is Dr. Madan Mohan. He has extensive experience in bridging yoga therapy and modern medicine. As head of physiology at JIPMA for over 2 decades, he participated in a number of important studies that have been key in providing evidence-based research to support the benefits of yoga. Dr. Madan Mohan explains that modern medicine is very effective in managing acute conditions such as accidents or infection. But it is important to note that over 70% of diseases nowadays are chronic conditions, such as hypertension, diabetes, heart problems, arthritis, or insomnia, where allopathic medicine primarily manages symptoms.
And therefore, yoga has a role to play in most of the diseases. yoga is the primary therapy in early conditions, early stages. And yoga therapy later on as a complementary. Drugs have got negative side effects. Allopathic drugs are very powerful, very effective. And what I have seen that they cure disease, they produce one more disease. That is the real problem. Yoga is not like that. If you treat any condition with yoga, other conditions, suppose the hypertension you are treating, diabetes also improves, insomnia also improves. That's the beauty of yoga.
The treatment programs for patients are developed by Dr. Madan Mohan and by the Deputy Director, Dr. Ananda Balayogi Bhavanani. Dr. Ananda explains the procedure when patients come into the Yoga Therapy Center.
Now, when this patient comes to us, we have a one-on-one meeting with the patient, a consultation, where we determine whether yoga can help the person. Most probably, yes. How much yoga can help the person? And the first question I often ask our patients is, what do you expect from yoga?
The yoga therapy program is completely integrated with the patient's regular allopathic care and designed for each one's individual needs.
Based on the diagnosis, which already they have gone through all the diagnostic tests, the blood tests, the x-rays, the scans, we then try to determine which of the yoga techniques can best help them in their present condition, which of the techniques they can do.
Patients come into the yoga therapy program from two main avenues. The first is through referral from the hospital staff who have come to understand which conditions are best supported by yoga therapy. This includes musculoskeletal issues such as back pain and conditions with a strong stress component such as hypertension, type 2 diabetes, and digestive disorders. The second avenue is when patients come in for a regular checkup. Along with assessment of the regular parameters, patients pass through a yoga therapy screening where they are oriented to the benefits of yoga. For Dr. Ananda, yoga therapy is much more than selecting yoga techniques. It is choosing practices appropriate for the person as a whole, including their family, work, culture, religious background, and goals. The key to designing a yoga therapy program for the whole person is careful listening.
Because we doctors today don't listen to patients. We are so busy filling up forms and getting things done, we don't listen. And so the moment you give them the time, you listen to them, they realize you care for them. So it is not about finding the right technique for the right condition, for the right patient. It is about how can you get the yoga into them, plant that seed.
Different from allopathic medicine, yoga therapy depends substantially on the participant's commitment. Part of Dr. Ananda's role at CYTER is encouraging patients to become active in their own healing.
And one thing I always reassure them, I say, if you do these practices, if you change your attitude, if you change your lifestyle, your diet, your sleeping patterns, your work patterns, if you change it, you will definitely have benefit. How much benefit depends on your effort, nobody else's effort. You make the effort, you get the benefit. And perfection is not required to get the benefit. You do not have to do the technique perfectly to get the benefit.
Based on an overall understanding of the patient, Dr. Ananda elaborates a regime of those practices that would be most helpful, as well as those that should be specifically avoided. This menu is then discussed with the head yoga therapist, Meena Ramanathan, who begins the process of implementing the yoga therapy program. Patients come several times a week for one-on-one yoga therapy treatment sessions. Dr. Bhavanani meets with the yoga therapy patients every few weeks to check their progress and update the practices they need. The psychological and spiritual dimensions are key to the effectiveness of yoga therapy, and Meena Ramanathan, the head yoga therapist at CYTER, explains the importance of integrating them into the treatment programs.
And once you start corresponding to them as they are, then doesn't it become yoga therapy on its own? And unless and until they enjoy something, enjoy it from their heart, from their being, how do you think the change can happen? You know, like you would have done 1,000 hours of whatever it is to get a PhD. But that, is, I should say, the secondary criteria of being a therapist. But the primary criteria is that you need to understand one as a being.
Providing research-based evidence to substantiate the value of yoga therapy is a main focus of the Center for Yoga Education and Research. Dr. Madan Mohan, CYTER's director, has conducted yoga research since 1971 and authored over 100 research papers. He has presented seminars on yoga therapy in many of India's most distinguished academic and spiritual institutions, and has received the Doctor of Science Award from the S.V. Yoga University. Yogacharya Dr. Ananda Balayogi Bhavanani, CYTER's deputy director, has authored over 120 papers on yoga, which have been published in India's most distinguished medical journals. He is a fellow of the Indian Academy of Yoga and an honorary advisor to the International Association of Yoga Therapists. Individually and as a team, they have made significant contributions to the field of yoga therapy research. In a study conducted with 60 nursing students, it was concluded that the psychological and physiological effects of their yoga practice were indeed measurable, and that the practice of yoga is a valuable addition to the medical study program. At the conclusion of the study, nursing students showed increases in bone marrow function, reduced allergic tendencies, and perceived improved quality of life. In a study using 26 subjects in stable health, it was found that left nostril breathing produced a greater reduction in heart rate and blood pressure than right nostril breathing. They also associated an improved muscular reaction time with right nostril breathing. In another clinical study, 4 poses were selected that would mobilize the spine of the 22 participants in all directions. It was concluded that the body's relaxation response was more effective following practice of the poses. The postgraduate program in yoga therapy at Mahatma Gandhi Medical College is the first of its kind in India. The Dean of Postgraduate Programs and Research, Professor N. Anantakrishnan, explains how the graduate program came into being.
We decided to focus on the interface between modern allopathic medicine and complementary and alternate systems of medicine. But there's one area where we can go in because it is largely virgin, unexplored. So that's how it started, and we hope we are right in our decision. Time will tell whether the decision we made is correct or not, but I think it's something that the country needs.
This 2-semester year-long course prepares its graduates to work in hospital yoga therapy departments such as CYTER. Among the subjects studied within the program are how to prepare specific yoga programs for patients with particular health conditions, the benefits and contraindications of the main yoga practices, an understanding of spirituality as the foundation of yoga therapy, the ability to communicate clearly to patients the role of yoga in enhancing the quality of life, the ability to incorporate yoga into rehabilitation settings, including physiotherapy and cardio rehabilitation, and the ability to provide yoga therapy in psychological and psychiatric settings. In order to make this type of postgraduate program part of mainstream medical studies in India, the Dean suggests that colleges such as Mahatma Gandhi will have to move forward on several fronts. They will need to spread the news of their work to other hospitals in India so that medical practitioners and professors come to consider yoga therapy a valid facet of mainstream medicine. They will need to demonstrate the value of having a yoga therapy center like CYTER within the hospital, thereby creating a demand for postgraduate level yoga therapists. Most importantly, they will need to continue the focus on research, because this scientific validation speaks most loudly within the medical community. CYTER is also exploring the possibility of offering the postgraduate program as a 3-month intensive so that it is more accessible to international students. The patient treatment programs, together with their wealth of research data, forms a strong scientific basis substantiating the validity of yoga therapy. Through CYTER's outreach programs, this information is shared with doctors, other health professionals, administrators, and the wider community. At a recent symposium, more than 250 medical professionals and students participated in practicing yoga and in reviewing some of the latest research findings. CYTER also held a 6-month training program for 60 nurses, orienting them to the benefits of yoga therapy. One of CYTER's objectives is reaching underserved populations. The CYTER team recently conducted an outreach program for 80 seniors over a 6-month period, showing that yoga therapy is an effective way to provide low-cost health care and develop group support. CYTER reaches out to the business community through a program promoting the benefits of a healthy, yoga-based lifestyle to reduce the risk of hypertension, heart disease, type 2 diabetes, and obesity. At the level of the entire community, CYTER participates in the yearly Pondicherry Yoga Festival. The government of Pondicherry has been conducting the International Yoga Festival since 1993, bringing together many of the leaders within Indian yoga to expand awareness of yoga's benefits. Through this festival, CYTER promotes yoga's beneficial effects for health, bringing awareness to the Yoga Therapy Center as a resource for the community. The wholehearted support of its staff, the hospital administration, and the wider community makes CYTER a vibrant, effective yoga therapy center. All of the facets of CYTER come together to form a mandala of health and healing for the patients, the medical staff, and the entire community, bringing yoga therapy into the world as a lived reality. For more in-depth information on CYTER and its activities, click on the complete interviews with Dr. Ananda Balayogi Bhavanani and Meena Ramanathan.